Good afternoon, everyone, and welcome to this webinar. Today, we'll be introducing two key and relatively new tools which guide the planning, budgeting, and implementation of an effective and efficient national condom program. So it's great to see all of the participants joining. I see in the chat function, we've got representatives from ministries, Uganda, Ghana, South Africa. We have memberships from NAC, the CDC, South Africa, and many others. So it's great to see so many different participants here. As you join, I would just like to call your attention to the chat function. Please do introduce yourself and let us know where you're from. And also, we have a Q&A box, recognizing that we would like to make this session as facilitative and engaging as possible. And we'll use this technology, chatting within the Q&A box, to ask your questions to participants and to those that are presenting this work. I also like to call attention for those of you speaking Portuguese that there is translation on the click button down below. So Yanni, if we could move forward 2 slides, please. And first, I'd like to introduce myself. Today, I am Chris Jones. I work with Man Global Health, and I'm supporting the South to South Learning Network as a consultant. And as I said, today we'll be introducing 2 key and new tools, relatively new tools that will support your condom programs moving forward. Today, we've structured our session. We'll begin with Clemens Benedict from the Global Prevention Coalition, who will introduce the context of this work within the broader prevention work. And then we will be focusing on the introduction of the 2 new tools. The Condom Needs Estimation Tool is critical to getting quantification and procurement right, particularly in the context of a TMA. Henk van Rentergem from UNAIDS will be leading that presentation. He'll be supported by Coke Rotich, Charles Burungi, and Majilawa Marwa, both of them presenting the context from Botswana, Zimbabwe, and Tanzania. We'll then shift into presentation of the Condom Planning Package, which supports development of national operational plans, improving the quality of funding proposals, decisions, and implementation. Brian Smith will be leading that discussion, and he will be supported by Zidio Nantumbu from Mozambique NAC, as well as Susie McLean, who will also be presenting the context from the funder's perspective to talk about why solid condom strategies are helpful in supporting funding decisions by the Global Fund. The way that we'll structure our sessions is a brief introduction of the tool itself. We'll have introduction of the context in various countries, and then we'll have some time for Q&A. So this is the time at this point where you can ask your questions and whatnot. But first, if we can go to the next slide, please. I'd like to just briefly introduce the South to South Learning Network, which connects countries to learning and best practice driven by peers in other countries. The network aims to identify programmatic gaps and priorities for their HIV prevention response. It is building social capital for problem solving and is documenting, sharing, and exporting best and promising practice throughout the region. It helps countries to accurately identify their capacity development and technical assistance needs, and importantly, aims to help attract funding and support for condom programs, which is particularly important given that the network focuses it on prevention as treatment is overwhelming countries in terms of taking an increasingly larger share of budgets. So this is an opportunity to spread successful, innovative practices focusing on prevention, which is just critical to controlling the HIV epidemic in your country. And next slide, please. The South to South Learning Network is engaging with 10 participating countries, which you see on the right here, ranging from Ghana and Nigeria in West Africa, and then other countries throughout East and Southern Africa. The program deliberately focuses on 2 key elements of prevention. First, on key populations, MSM and female sex workers, but also on condom programming. It's a learning project supported by the Bill and Melinda Gates Foundation and really aims to prove concept to just ensure that we can get this right. Next slide, please. I'd like to introduce now Clemens Benedict from UNAIDS to talk about the perspective of this work from the Global Prevention Coalition. So Clemens, over to you.
Thank you so much, Chris, for this introduction, and welcome again to everyone joining this group on behalf of the Global Prevention Coalition. You are really the champions of condom programming, and we are really happy that you have joined this side-to-side learning network, and will continue to act as champions for the condom program agenda, which does not have all that many champions today to drive it forward. So your role in actually driving the condom programming agenda is absolutely critical from our perspective. Why is this important? The new global AIDS strategy, which is currently being shaped, is actually focusing on HIV prevention. Clearly, new HIV infections have not declined as fast as we had hoped for in light of the new technologies, the rollout of treatment, and the promises of combination prevention, but we clearly have substantial gaps in HIV prevention, and therefore we think the world needs to refocus on HIV prevention as a core priority of the strategy for the next 5 years. It's not an easy moment for actually reviving and strengthening condom programming. You know that, and some of you have seen the actual data in our most recent report. In 2019, that's even before the COVID pandemic, there have been more countries that reported declining distribution of condoms than increasing distribution of condoms. We have seen also in our latest report, there's declining condom use among young people in a number of countries. Initially, it was a few countries, but we have seen now in several countries a pattern of declining condom use. And we have seen, obviously, as many of you have experienced yourself, some disruptions of condom programming in 2020 due to the COVID-19 pandemic. However, we have seen in a number of countries that the uptake after the first wave of lockdowns has been good, but even that picture is mixed, and we'd like to encourage you to really also use this network to exchange your experiences on addressing COVID-19 related challenges to condom uptake and distribution on the ground in particular. With the new global AIDS strategy will come new global targets for HIV prevention, and these targets will include condoms again, and actually a very aspirational and ambitious target has been formulated in terms of 95% use of combination prevention. And that includes a target for condoms as well. But it's a more people-centered approach to targets than it has been previously. So it's a mixed target for different combination HIV prevention interventions. So that means the condom target will not universally apply to everyone who may be using another prevention method such as PrEP, or who may be using U equals U, undetectable is untransmissible, as an HIV prevention strategy. So there's more nuance and differentiation in the condom targets, and the condom targets are actually separate, just like all the targets in the new global AIDS strategy, for different populations. So will actually be disaggregated by subpopulation. That's by age, by sex, and by different key populations. The targets are actually outlined in the new global AIDS World AIDS Day report that was launched in December. If you haven't seen them, we'd like to encourage you to go to that report, and the targets will then obviously feed into a new global prevention roadmap, and eventually we expect a new political declaration also to affirm these combination prevention targets, a new generation of targets for people-centered combination prevention, including a strong component on condom programming still. Last but not least, I think what is at stake is really the continued and in many cases strengthened public commitment to a sustained condom response and program. That doesn't mean that it all has to be public sector. It will have to be, and Chris and others will speak to this in much more detail, a multi-sectoral approach with really complementary functions. But what we need is the strong government and public leadership in actually strengthening the stewardship of the condom response and reaffirming the leadership at all levels. And that's the political level of making investments, moving domestic resources where possible and other international resources into condom programming, leadership at the programmatic level to use the resources well, have effective, innovative demand generation and lifestyle distribution programs, and also leadership at the community level to meet community demands and actually integrate community perspectives into condom programming. So with that, I'll just end here. Thank you again for joining, and I think we're looking forward to a really exciting session. Over to the moderator, Chris. Thanks.
Thanks so much, Clemens, for your energy, enthusiasm, and leadership in this space. Clemens has been leading so many different efforts at the global level to ensure that resources, technical support is available to country programs. So you should, if you're working in the condom sphere, see Clemens' name pop up repeatedly, as you will with Henk van Rentergem, who has been supporting condom programs for many years with UNAIDS. Getting condom commodities right is critical, given that the proportion of budget support that they require of condom programs, and making sure that you've got the right quantification in place is critically important. Henk has developed a tool over the last few years and has been rolling it out in countries that aims to support countries to do exactly that, making sure that they've got the right quantity of condoms going to the right sector, targeting those that really need them. So I leave it over to Henk and colleagues to describe the introduction of the Condom Needs Estimation Tool, how it's used, and how it can be benefits your program. I would just like to say before Henk starts, if you do have a question, please type it into the Q&A box, and we have time after each session to answer some of those questions. So thank you very much, and over to you, Henk.
Thank you, Chris, and hi to all participants and colleagues. I see a lot of familiar names, and that's nice to be in touch again. I think what is also nice is that quite a few countries represented here have actually used in the past in some way or the other the condom tool. So I think there is a lot of experience in the room that we can use for our discussions. I will briefly introduce the tool and then ask my colleagues if they can join. Majaliwa from UNFPA Tanzania and Charles from UNAIDS Zimbabwe to speak about their experiences. But a few minutes ago when I checked, I saw they had not connected yet, so we will have to be creative if that doesn't work. Anyway, let me go to the next slide. So a few years ago at global level, when I think around 2015, when the realization that there was serious challenges with condom programming across the world and many different dimensions contributing to these challenges and decline in support for condom programming, there was an agreement that we needed a better condom needs estimate methodology that was not only standardized and data driven, but that also was much more flexible and where country ownership would be much easier to obtain. So not necessarily an expert driven tool. So that's when UNAIDS and UNFPA, and in collaboration with the Global Condom Working Group, started working on developing this tool. Quite a number of characteristics we wanted and gradually built into the tool. It took a few years before we had a product that actually was ready for use, and that for the past 3-4 years we've now started rolling that out, and I think it has been applied quite systematically in 20 or 30 countries or so. Both in sub-Saharan Africa and a few countries in other regions. What I think is the big difference with this tool is really this very strong focus on its people-centeredness. It's starting from the needs of the specific priority population groups, and that really shapes and drives the whole tool, and all the implications it has and how it functions and the results it presents are around the fact that we start from the specific needs for condoms from the specific subpopulations. And as you can see here, the tool is available together with guidance on the site of the HIV Prevention Coalition. It can just be downloaded there. Next slide, please. A very basic overview of what the tool does in a process where countries engage in using it. It's really starting from the identification on the left of your priority populations for condom programming, the setting of specific condom use targets for these populations, and then driven by quality control data to inform the estimate. And we pride ourselves that setting of targets that Clemens was just referring to, population-specific targets, that the Condom Tool was a bit of a front runner in that. So based on that, and a process at country level that is owned by the country and a partnership of a multi-stakeholder working group, you conduct the total condom needs estimate for your country based on the sum of needs of each of the priority population. And that gives you an overall estimate for your condom needs. And then the tool has options to go and dig deeper in your specific needs and helps you to identify and quantify lubricant needs, the needs for male and female condoms, the need for special condoms. It allows you to define where free condoms are most needed, which population and which proportion of the population needs free condoms, and then to develop your total market scenario by assigning which populations and which proportions of condoms should be channeled through the specific sectors of your total market approach. And finally, based on all that, it pulls it together into an estimate of commodity costs for your national condom program using your the unit cost of the UNFPA condom procurement facility. It generates a set of results, outputs that then can be used or should be used for advocacy around your condom program by showing your needs and gaps, by developing and informing your national condom strategy or your national strategic plan, to inform resource mobilizations and procurement of condoms. It also, because of the strong focus on setting condom use targets as a critical element in your estimates, it paves the way towards your program design, and also it entails a strong reflection on what capacity do you actually need to program this amount of condoms for these populations. And finally, because it sets clear targets and estimates, it does conduct the estimates, it supports developing accountability frameworks. Next slide, please. This is basically the same, repeating in a bit more detail what the Condom Tool, what the CNET actually does specifically. We can move to the next slide. So as I said, critical to the Condom Tool is this identification, prioritization of populations that have priority needs for condom programming. And the identification is based on their higher risk for HIV, STIs, and unintended pregnancies. That is another feature of this tool and methodology, that it looks at the comprehensive condom needs in the country. And the tool, based on what we know and the evidence we know, proposes a standard set of priority populations, people living with HIV, sex workers, men who have sex with men, sexually active young people, adults with non-regular sexual partners, couples who need condoms for family planning, people who inject drugs, transgender people, and then it allows countries and users to define other additional populations at higher risk, depending on your specific context in your country. Next slide, please. Very basic. As I said, the needs estimate in the tool is based on adding up the needs of all priority populations. And for each priority population, the needs estimate is based on a very simple formula, which is based on the population size for the specific population, the average or the estimated number of sexual acts per year in that population, the condom use of coverage target that you have defined for that population. When all that is added up, it gives you the total need of your condoms in that population for a given year, to which we add a certain amount, a proportion of what we call wastage. Basically, we know that in condom programming, not all condoms end up being used. So you need to include the wastage. What the tool does, it basically, for those countries for which we have the data, and that is approximately 75 countries across the world, it provides preloaded data that are needed to do this estimate. So the tool, based on this formula and the preloaded data coming from validated data sources, will immediately conduct a standard estimate for your country based on the standard population, standard formula, etc. And in case of missing data for certain specific countries, when there is missing data, we use expert vetted proxies or default values. Next slide, please. And this, if you are familiar with the tool, but we won't have time to go into that, this is the critical sheet in your tool, which is an Excel-based application. And this is the sheet where you can see where the actual estimate is being done. On the left-hand side, you have your priority populations included in your estimate. The columns B and C are the population sizes at the baseline year and the projection of it. And then you have your variables that as a user, as a country, you modify, which basically are your condom use target for each of the populations, your annual number of sexual acts, and your wastage. And based on these variables, then you have an estimate, a calculation of your needs for the next 5 years. And that you see on the right-hand side of your screen, of that spreadsheet, for each of the populations. And these totals are added up in green to the total estimate for the given country. And as you can see, the tool provides some standard scenarios in terms of condom targets that are used to provide standard estimates. In this case, a standard scenario of approximately 75% of condom use in the country. There are other scenarios provided in the tool for comparison reason, a 60%, 90%, and 100% condom use scenario. Next slide. So now all of what you saw in the previous sheet is driven by the data in the data sheet, which is the data sheet where the country, the user, can validate all the entries into the estimate. And this is the second most important sheet in the tool, where the country teams review the data that are being used, adapt and upgrade or update these data. Next slide, please. The data and the results are subsequently presented in graphics that are easily to look at and to copy into reports or PowerPoints for your further use. And here, for example, you see the estimate on the right of total needs estimate in a country between 2019 and 2023. Next slide, please. It will break down and visualize the condom needs per population group, based both in absolute numbers and in proportions. And that often will give you more insight in how to start constructing your program in terms of reaching the needs of these populations. And these graphs actually come as a surprise, often in countries where we under or overestimate what were in the past the needs of specific population groups. Next slide, please. One specific feature in the tool, and we're talking in the global strategy also, and on people-centeredness and the issue of equity, is to ensure and take very deliberate and conscious decisions on who should get free condoms. We want to ensure that people cannot afford to pay for condoms, get the condoms for free, the condoms they need for free. And based on that, then you can start constructing your total market scenario. Next slide, please. And this is then the example on your left side. On your left side, the outcomes of an initial scenario, a current baseline scenario for your total market. This was in Rwanda, an exercise where you see that there is an increase in free distribution through the public sector, a decrease in social marketing, and a slight increase in the private sector in the scenario that was then proposed. And then finally showing you, and this is all coming once you've done your estimate, all this is generated and you developed your scenario, all this is generated automatically by the tool. These are then visualizations of the commodity costs for your program based on the scenario you have developed. Next slide, please. And I want to close by insisting or sharing the lessons learned around doing it and using the tool. Using the tool at country level really is a process. Just applying the tool is very easy. You push on one button, you validate and change your data and your assumptions, and you have your estimate. But meaningfully using the tool and its outputs is really a process. Ideally, you link it to the development of a new condom strategy, a global fund application, an annual program review. And critical in the process is really to set up a working group which involves all key stakeholders. You need to build ownership around these estimates, especially around the target setting and the needs for specific populations, together with your stakeholders. Don't leave it only to the experts or to the people who traditionally do estimates of commodity needs, reproductive health commodity needs. You get into trouble when you start coming to the specific needs of specific populations and how you're going to program these condoms. It is important that you have a smaller task force who is responsible for manipulating the tool. So people with good skills, expertise in Excel, use of data, and EPI experts. Training and TA is available and can be sourced by contacting UNAIDS and UNFPA. There is an important piece of work around collecting and reviewing the data. And it leads to asking pretty difficult questions about what is the state of your condom program? What is the capacity? And that is in the development of your needs scenario. What is the capacity of my condom program to actually deliver on the needs I have estimated? And there is a dialectic process between what you estimate and what you in the end up agreeing that you need to procure in function of the capacity of your program. And it raises questions about the needs for capacity strengthening of your program. And that again, and that is in the last points, is really that often implies that you will need to create buy-in and support for changes and decision-making and resource allocation. So don't just think about the tool as a tool that provides you an estimate and then start dealing with the challenges. Use the process around the tool to start creating ownership. And then use the tool on a, I wouldn't say continuous basis, but be flexible and update once you have a good estimate, a good scenario, update and revisit the scenario and the estimates regularly and as needed. Next slide, and I'm curious to hear whether the colleagues have joined. But Jaliwa, are you available?
Yes, I have joined.
Oh, okay, great. So over to you for sharing your experience.
Thank you, Henk, and good afternoon, everyone. I'm going to share with you very briefly the experience from Tanzania. And I'll be sharing this on behalf of the team. Unfortunately, my colleague, Koech, could not join us. He has another meeting. So to start with, I would say that Tanzania first got exposure to the tool way back in 2008 in one of the meetings in Johannesburg where the tool was introduced. And a few colleagues were there, UNFPA and some colleagues from the government. And then the actual use of the tool happened last year when we were developing the Global Fund concept note. Previously, Tanzania used to conduct the quantification exercises for reproductive health commodities, including condom for HIV. And this was done through a consultative process where stakeholders were convened and using various data that were available and some assumptions, we came up with the needs for condom. However, it was obvious that there were some gaps, and the tool came about to address some of those gaps. So to share the experience, how we went about to use this tool with the Global Fund concept note, Condom, as part of the fast tracking HIV prevention, the Global Task of 2021. So through the support of the UNAIDS headquarters, we had a virtual support session where stakeholders were taken through on how to complete the tool. A team of experts led by National AIDS Control Program and targets spearheaded the estimation processes. And the headquarters UNAIDS provided TA, but also supported with some more recent data, update the tool with the more recent data from the Tanzania HIV Impact Survey of 2016-2017, which is the latest HIV survey. Next. So I would say that using the tool, the process wasn't 100% smooth, if I may use that term. So there were some hesitants, there were some worries among stakeholders. People were asking about the inbuilt formulas, the proxies, and the default values. Some people are not comfortable with those elements, and then there are people who thought probably we should continue with our old way. However, as I said, with the orientation that was conducted, I think people gained more understanding of the tool and they saw the benefit of using the tool. So the tool was used to advocate for and influence condom planning and investment during the Global Fund grant application. in relation to the general population, key population, and the adolescent girls and young women. It allows for the review and alignment of the condom strategy to adopt a total market approach. Also ensured that it helped in targeting of public sector condom distribution beyond health facilities. The tool also provided data that will strengthen demand creation for increased condom use among the targeted population, because we saw when Henk was presenting that one thing that the tool gives you is giving you different population needs. So this is also help with information that can be used to strengthen demand creation. And lastly, also it helps to harmonize and strengthen the condom M&E system to ensure the availability of data at the central or national level for planning and decision-making purposes. So to be able to use the tool and get the most out of it, you need to have good data. And I think the worries on the use of proxies or default values will go away if at the national level and the subnational level we have good quality data that can be used with the tool. Next slide. Yeah, so a few lessons learned. I think the tools, what we saw is that the tool allows for segmentation by source, the source of meaning that the source of condom. So it tells you what you are getting from public sector, private sector, social marketing, etc. And therefore allows for programmers to plan and forecast for the number of clients that will be served by a particular source or sector. Also, the users can identify supply and funding gap across each sector. It also allows for scenario building. The scenario building features allows for users to define the future distribution pattern based on the current condom landscape. So it allows users to estimate needs across distribution channels in order to achieve an optimal market mix. And lastly, it gives a clear distinction in quantification between condoms for HIV, STI prevention, and for family planning needs. And this is something that I think was not coming out very clearly in the previous approaches we use for quantification. Getting a clear distinction, how much condom goes to HIV prevention, to STI, and family planning. And this is very important for planning and monitoring purposes by different health areas. So we have a few recommendations, and I think, and I would like when I'm done presenting, if my colleagues also can add one or two things if they have on the recommendation and the lessons learned. So the tool should be used consistently. We are suggesting that on an annual basis, but I think I saw Henk saying that the tool should be used regularly, updated constantly. So I think we're also recommending the same. Analysis from the tool should be used to inform strategies for proper targeting of condoms. And lastly, if there could be additional consideration added to the tool to allow for its use in monitoring efficiency of condom supplies, considerations such as condom stockout per sector, unmet need, and unmet demand per sector. So these are the three things that we are recommending, but as I said, I would like to also invite my colleagues who are joining this meeting, Kate, Hafid, and Baraka. If you have any comments, quick comments in 1 or 2 minutes, please unmute and share your comments. So thank you, everyone.
Thank you, Majalawa. Thank you so much for sharing your experience from Tanzania. This is so helpful for us to better understand how we can apply the Condom Needs Estimation Tool to your country context. We're going to shift our agenda slightly just to accommodate and ensure that we've got enough time to present the other package available, which is a tool supporting strategy, and ensure that we've got time for Q&A as well. So what we will do is handle the question and answers at the end of the session. And we will now move to strategy, which is where it all starts. We need to ensure that we've got all partners in a country working towards a set of prioritized objectives and goals. A team from Man Global Health have developed guidance to support countries in the development of quality strategy. Before I hand it to my colleague, Brian Smith, to introduce that process, I'd like to ask Susie McLean, who leads up the Global Fund's HIV prevention efforts, to talk a little bit about the role that condom quantification, as described by Hank just now in the CNET, as well as good strategy supports funding proposals. So over to you, Susie.
Thank you, Chris, and hello, colleagues. My name is Susie McLean. I'm a senior advisor on HIV prevention at the Global Fund. And apologies that I've had to be bumped up the list. I've got to attend another webinar in 10 minutes. So I just wanted to make a few comments about Global Fund's interest in this work generally. So it reflects our interest, our wider interest in improving our HIV prevention investments, and is a key part of that interest in improving HIV prevention investment. We're really keen on strengthening our and making and refining, if you like, our condom investments. Yeah, so part of this interest recognizes on the one hand that the Global Fund's been a strong funder of condom commodities for many years now, as many of you will know, and working closely as part of the Global Prevention Coalition and looking at the performance on condom use, where we're making big investments, and looking more generally at the analysis that's being generated from the Prevention Coalition and other places. We've observed over the last couple of years that our investment has been predominantly in condom commodities, but that there's more that we need to do to invest in the systems, if you like, to ensure that our investment in commodities, we get maximum value for money. So for example, we see a lot of outcomes in Global Fund performance frameworks that are around increased condom use amongst priority populations. And then that's kind of at one end of the scale, and at the front end of the scale, if you like, we see some significant condom investments. And so what we're trying to do is see a stronger connection between those large-scale investments in commodities and improvements in condom use amongst priority populations. So we think, we're working with others, we're increasingly understanding that there's additional investments there. And the Condom Planning Package speaks to these kind of other interest areas. But fundamentally, we understand that investment in improved condom program management and stewardship, and a very strong interest in improved investment in demand creation, targeted demand creation for priority populations, and improved investment in last mile supply activities or platforms. So for example, our interest in ensuring that condoms are getting beyond clinics into hotspots and bars and kiosks and places where our target populations need rapid access to condoms and lube. So as part of this interest, we've been working closely with UNAIDS, the Prevention Coalition, the Gates Foundation, Man Global Health, and others to emphasize these other elements of investment in the Global Fund systems. And so, for example, some of you will have observed that we have a new module in our modular framework that's called Condom Program Management. And I know some applicant countries that are represented on this call have proposed investment in that domain quite recently, and that's very welcome. So Yeah, just an additional thing I wanted to let people know, again, to reflect the Global Fund's interest in this area, is we have some strategic investment in condom program management and stewardship. So, and some match funding, so catalytic funding for improved condom program investment. That will apply in 4 countries, Malawi, Mozambique, Uganda, and Zambia. So there'll be some more focused attention with Global Fund resources for example, increased investment in management systems or data systems, and there'll be increased TA networks in those 4 countries. But I suppose more generally, I wanted to say that we hope that catalytic investment in those 4 countries will be relevant and interesting for other countries that are not directly involved in the strategic initiative. So that's why it's been very helpful for us to work with partners such as the Prevention Coalition to try to extend the value of this work beyond those 4 countries. Final comment, and then I'll hand back to Chris, but just to say that, to point to a really important consideration or principle underlying this interest is about sustainable systems for sustainable condom systems. And one of the things that's really important for the Global Fund is that that we're investing not only in the commodities that people need now and in the next 3 years, but that we're also investing in systems that will be strong and sustainable into the future, so that we're not undermining other elements of a total condom market. We're making investments that support a total market approach, and that we're really wanting to, it's part of the reason why we're so interested in these tools, really interested in ensuring that our investments are very prioritized, that we don't think it's the Global Fund's role to fund condoms for whole populations, but we definitely do for populations with enhanced HIV prevention needs. And so tools and debates and discourse and developments that are assisting us all to better prioritize our investment towards people with the greatest prevention needs is a strong interest of ours and very welcome. And as such, we really welcome initiatives such as the Condom Needs Estimation Tool and the Condom Planning Package that we're about to discuss next. Back to you, Chris.
Thanks so much, Susie. Susie has been just such an important advocate for ensuring that we've got funding going to not just prevention programs, but to condom prevention overall within the Global Fund, as well as the community of donors. So we really appreciate her efforts in participating on this call, but also all the work she's doing behind the scenes to ensure that country programs have the funding they need to support well-planned condom programs. And with that, I transition over to Brian Smith. I do continue to encourage you to type in your questions into the Q&A box. And getting back into Hank and Majaliwa, we will be sure to answer those questions as well at the end of this webinar. So Brian, over to you.
Thanks a lot, Chris. As Chris said, my name is Brian Smith. I'm a consultant working with Man Global Health. And I've been working in HIV prevention and family planning, and more generally in public health for about 20 years. And part of my career was managing condom social marketing programs in various countries in Africa. Today, I'll be providing an overview of some tools that are intended to support improved condom programming that Chris and I have been leading the development of in collaboration with many others, and based on our work across many countries. The package supports national programs in developing strategic operational plans for condoms. And it's been developed with support from the Gates Foundation and with the collaboration of the Global Prevention Working Group. You can go next, please. And so again, just briefly, the Condom Package provides a step-by-step process to produce these operational plans. And the intention is to achieve, as Susie was saying, sustained increases in condom use. Next slide, please. Briefly, what I'll be talking about today, What problem are we solving with the package? How does the condom planning package help solve those problems? What's included in the package? And then what support is needed to implement the package? Next slide, please. So what problem are we solving? Why do we need better condom planning? First of all, as Clemens mentioned in the beginning of the session, condom use remains low in many countries, although there has been steady, slow growth. In some countries, it's stagnating. And in most countries, it remains far below targets that we'd like to see achieved. Next. And in part, the reason for condom use being low is that the priority constraints at the country level are often not identified and then not funded, in part due to weak program stewardship. And all of the previous speakers have talked about that. By program stewardship, we mean essentially the group of functions, usually led by the NAC or MOH, that enable all actors and stakeholders to work together in a systematic way to improve condom programming and outcomes. So this includes coordination across stakeholders, strengthening financing, forecasting needs, as Hank has talked about, and developing, disseminating program analytics, and of course, strategic planning. What we're also seeing is that the barriers to condom use are not adequately addressed. Next, please. And in large part, that's due to underinvestment in demand generation. And we're not investing wisely in demand generation, often because there's a low understanding of the barriers to use from a person-centered perspective. We're just not investing what's needed to really understand the perspective of users and what makes it challenging for them to use condoms. Next. And finally, where condom strategies do exist, they can be improved. Oftentimes we see in the existing strategies that there are so many priorities that it's like there aren't any priorities. And I think people are familiar with that challenge in strategic planning, is to make those difficult decisions to set priorities. There's often insufficient identification of target populations, or maybe over-identification in a sense, because a lot of the plans are trying to reach everyone. And so there's not really a targeting of limited resources. And finally, the strategies are not always driving funding proposals. Next slide, please. So how does the condom planning package help? Overall, we want to have plans that lead to action. I think we've all experienced strategic plans that get developed and then essentially are put on shelves. So we really wanted to develop something that was hands-on, more hands-on than previous efforts. Next, please. So we apply what we call that is applying an operational lens to strategic planning, that it needs to have that operational aspect to be as useful as possible. Next, please. We essentially organize the tool around answering three questions. Where are we now? What is the current context? What is the situation? Why is condom use slow? Who's using, who's not using? That's the first question. Next, where do we want to go? What are the activities? What are the goals that we want to set for our planning? And then finally, how do we get there? What are the activities that will be implemented in order to drive condom use and get us where we want to go? We then generally recommend that the plans be organized around the three key themes that we've touched on previously: program stewardship, demand, and supply. Next, please. We also provide examples from other countries. We found that that has been extremely useful for countries that are new to strategic planning to see how their peers across the region have addressed similar challenges. Next, please. And the condom planning package complements the UNFPA 10 steps. Essentially, it provides hands-on tools in order to implement several of the steps in the 10 steps. So we build on the previous work that is very widely known across the region that had been developed by UNFPA. Next slide, please. All right, what are the components of the package? Next. First of all, there's a step-by-step process that walks you through all the steps you need to get to developing and then launching your strategic operational plan. Next. We provide a lot of guidance on how to answer the "where are we now" question, which is essentially the situation analysis. This is really it's really the critical piece in developing your strategy. If you don't know where you are, it's hard to know where you want to go and how you're going to get there. So we provide a lot of tools and, again, examples from other countries of how the wide variety of data can be collected and then analyzed and presented back to stakeholders. Next. One of the big challenges is then taking all of that data that you're gathering through the situation analysis and figuring out, well, what is really the most important and most useful. That can be a very challenging exercise and one that's best done with stakeholders. So, you can't just sort of go to a room by yourself and work on it. We need all the stakeholders around the table to really be buying into setting priorities based on the data. So what we've provided is some pretty detailed facilitation guides to help the entire group of stakeholders move from analysis to then priority setting, making difficult decisions about priorities, and then work planning. Next, please. We also provide guidance for developing and implementing a monitoring, evaluation, and program improvement plan. So the emphasis again here is not just collecting data for the sake of collecting data, but really narrowing down the data that you're collecting to that which will be most useful, not only to monitor progress, but to help all of the stakeholders who are implementing the plan do better work. They can do better work when they have data that gives them feedback on how their activities are proceeding. Next, please. And finally, we provide a menu of activities that can be adapted based on your context. So this would be activities under how to improve supply, demand, and also program stewardship. Next slide, please. Right, so the first phase is really, I'll walk through the phases one by one here. The first phase we call prepare, and it's really about ensuring that we have the resources and the time to go through a proper strategic planning process, which really can take between 3 to 6 months. And a critical part of that is something that Hank and others emphasized, is to build ownership across stakeholders. So before we start, we want to think really carefully about who should we involve, how will we involve them, how will we make sure that they are providing input and participating in the decision-making process. That's phase one. Phase two is really the situation analysis and gathering data. Again, a lot of the stakeholders will be involved in that as well because they have the key data. You need to draw from many sources, so it's important to engage the stakeholders. Phase three, we move from using that data to really setting priorities. And sort of in between phase two, or in phase two and phase three, that something like the Condom Needs Estimation Tool is really, really useful, because there you can talk about your priority populations, their needs, and where they are in terms of condom use now and where you would like them to go, and what that then means for your programming, your condom procurement, and so on. And then finally, in phase four, we provide advice on how to launch the plan, communicate the plan to stakeholders so that they are aware and able to contribute, and then, of course, get the implementation and monitoring going. Next slide. The package includes advice on how to develop a results framework. In the interest of time, I'm not going to go over this in detail, but it is really a critical piece for a couple of reasons. Sometimes we have seen plans that actually don't set targets for some of the key indicators that would not only tell you if you're making progress, but also achieving the impact that you want. So it's critical to get the results framework correct, and we offer advice for how to do that. And this generic one that you're seeing here can be adapted, of course, to any country context. Next slide. I said earlier that, plans are only good if they're used. And, a lot of times we want to develop a long narrative that describes the context, the situation analysis, and then the plan. So that could be a relatively long document, which is often necessary and useful. But at the same time, we wanted to provide a format that would allow the plan to be summarized in just a few slides, essentially. And what you're seeing here is just an example of how a constraint that was identified in the situation analysis or the assessment phase, how that constraint is then addressed through a strategic priority. In this case, it's about improving public sector free condom distribution. But the idea here is that your plan can often be summarized in just a few slides like this, which lay out the key constraints, the strategic priority associated with that constraint, and then the activities that will address that constraint. And that provides a quick way for any stakeholder or manager to understand what the plan is about. Again, the emphasis being on something that is practical, operational, useful. Next slide. This is just a couple of screenshots from the first document in the package, which is called the guide. And you'll see again the phases there on the right. Next slide. This is another, just again, screenshots from the actual guide. I think Chris can or already has put in the chat window, or we can later, the link to where the entire package is located. So you'll have access to that from the Prevention Coalition website. Finally, the last slide here, what support is needed to implement the package? Again, the recommendation is that this be facilitated by a core group led by the government. So that's either the NAC or the Ministry of Health, but they are really the key to providing the convening power, bringing everyone together, and then the sustainability of the plan. Next. And then it should be very clear who are the individuals who will lead specific parts of the planning process. Next. Yeah, next, thanks. It doesn't all have to be in country. There are resources available, just as there are resources to help you with the Condom Needs Estimation Tool. There are also resources available to help you through the planning process. Next, please. And then it's important to note that we intend this package to really be a living document. So as people are using it, implementing it, there are going to be areas that can be improved. So we want to ensure that there's sort of continuous feedback coming back so we can make this package as useful as possible to national programs and their partners. And then finally, the long-term support for this will be provided by the Global HIV Prevention Coalition, also the South-to-South Learning Network. And then, as Susie mentioned, there is a new strategic initiative from the Global Fund around condoms, and it will also be drawing on and informing the package. Next, please. And with that, I think you're going to pause for questions, Chris, but I'll hand it back over to you. Thanks very much.
Thanks, Brian. We just wanted to give Isidio just a couple minutes to describe the application in practice in Mozambique, if you could. Just a couple minutes to describe that process, what it was like, and then we'll shift to questions and answers. I urge you to continue to put your questions into the Q&A box. We are answering some of them in writing as we go along, and we will also have a bit of time towards the end of this webinar to do so. So thank you very much. Isidio, are you ready to go? If so, you are muted right now. Okay, while we are waiting for Isidio, do we have any specific questions? We have one, Brian, that I'll direct to you related to the Condom Planning Package. What do we mean by the condom package? Can you just provide an overview of what specifically this tool will help us to achieve in the country programs?
What we mean by the package is the full set of tools that have been developed. So there's an overall guide to the process. There is a tool to help you implement a situation analysis. There are workshop guides to help you move from analysis to priority setting. And there are other documents to support you, such as terms of references for consultants who might help you, a terms of reference for your steering committee. So all of those documents together is what we are calling the Condom Planning Package. It's meant to be a sort of comprehensive package, but of course, if you wanted to use, a particular piece of it, you would be able to do that as well. And when you use the package, then the output will be a completed strategic operational plan for condoms. So that's a strategic plan that has a very strong operational focus with the type of sort of summary slides and outputs that I showed you in the presentation.
Great, thanks, Brian, for that answer. I think Ezidio is ready now. Ezidio, if you could just share the context in Mozambique briefly, and then we'll continue with our Q&A. Ezidio, I see you're on.
Just a question. I don't know if there's a video.
You can use
because I was invited to make some briefing on it, and I didn't prepare a video.
Yes. Do you have any comments that you could share without video, or with video as possible if you click the video function?
No, I don't have. Assim, não, meu caro, eu não tenho vídeo. Fui convidado para fazer briefing.
Yeah.
Então,
Ezidio, so I think it's fine. Just if you can just talk through, you don't need any slides, just to talk through some of the context for Mozambique. And I believe the translation should be working.
Okay.
I'll ask Carrie for you to speak in Portuguese, and the rest of us will hear the translation.
That's correct. Ezidio is welcome to speak in Portuguese.
Ok. Vou falar em português, sim, senhor. Muito boa tarde a todos, obrigado pela oportunidade, né? Eu chamo Ezidio Nhantumbo e sou o ponto focal do preservativo aqui no Conselho Nacional de Combate ao SIDA. Como devem saber, o Conselho Nacional de Combate ao SIDA é um órgão governamental que tem como função principal, portanto, a coordenação, facilitação, monitoria e avaliação da resposta ao HIV/SIDA em Moçambique. E esta coordenação é feita de uma forma multissetorial, onde estão envolvidos vários e diferenciados atores, não é? Desta resposta. E quando eu falo de atores, refiro-me aos atores dos setores público, do setor privado, da sociedade civil, incluindo os parceiros de cooperação. E como não podia deixar de ser, o Conselho Nacional de Combate ao SIDA prima, portanto, pela adoção das diretrizes internacionais que são emanadas para que, de uma forma global, a resposta ao HIV seja o mais eficaz possível, não é? E todos nós sabemos, e já foi aqui referido várias vezes, que a prevenção é uma prioridade, portanto, nesta resposta ao HIV. E sendo o preservativo o método de prevenção considerado mais eficaz, também merece uma atenção especial. E foi com base nesses pressupostos e outros mais, né, que o país decidiu que se deveria elaborar uma estratégia nacional para o preservativo, né, para melhorar a gestão deste em todas as suas fases da cadeia de abastecimento, até estar disponível para os seus utentes sempre que necessário, portanto, nas quantidades que esses utentes necessitam e em locais de fácil acesso, não é? Então, o desenvolvimento da Estratégia Nacional de Preservativo iniciou, na verdade, em finais de 2018, com um trabalho de campo, que era para entender melhor as percepções sobre o preservativo nos diferentes grupos populacionais. E desse trabalho resultou um primeiro draft, né, que depois foi utilizado para chegar ao documento final da estratégia. Portanto, ia ser a segunda fase que iniciou em 2019, usando informação dessa pequena pesquisa que foi feita anteriormente, Portanto, Moçambique teve acesso, portanto, àquilo que eram as ferramentas das quais o Brian foi aqui falando, e Moçambique teve a sorte de ter tido, entre aspas, tido as ferramentas na fase de teste, não é? Para desenhar essa sua estratégia. Não é? Podemos afirmar que a nossa estratégia reflete aquilo que as ferramentas orientam, não é? E para o bom sucesso desta nossa estratégia, iniciamos, portanto, com o desenvolvimento de uma análise situacional, nessa altura. Realizamos vários workshops envolvendo diferentes atores da resposta nacional e assim por diante. E esta estratégia nacional do preservativo de Moçambique culminou, portanto, com 3 pilares principais, que eu passo a citar, e também foi referido aqui nas apresentações anteriores, que é, portanto, a gestão do programa, não é? Em segundo lugar, temos a criação da demanda, e, por último, o terceiro pilar seria, portanto, a disponibilidade do preservativo. Portanto, esta nossa estratégia centra-se nestes 3 pilares. E este processo de elaboração ajudou também a identificar os desafios e prioridades estratégicas claras e específicas para cada um destes pilares. Não é? Foi possível também desenhar uma estrutura de resultados semelhante à que foi também apresentada aqui pelo Brian. Portanto, tivemos a sorte de entrar para o desenho da estratégia enquanto essas ferramentas estavam a ser desenhadas e, em menos de um ano, portanto, tivemos a nossa estratégia desenhada. E como antes eu disse, essa estratégia orienta os diversos setores do país, como devem definir as suas ações para o sucesso na gestão do preservativo em todas as suas fases. Né? E num passado recente, esta estratégia foi útil ao fornecer a informação necessária, portanto, para a elaboração da subvenção do Fundo Global, recentemente aprovada. Né? Portanto, esta nossa subvenção é de 21, anos 2021 a 23. Onde as prioridades definidas nas estratégias foram, portanto, levadas em conta. É de realçar também aqui que a ferramenta de quantificação das necessidades para o preservativo e para os gel lubrificantes de agora também foi utilizada para fazer as estimativas das quantidades que eram necessárias e de que formas é que o Fundo Global poderia também fazer a sua participação na aquisição destes produtos. Não é? É importante também realçar que este mesmo Fundo Global, usando esta informação que foi fornecida pela nossa estratégia, irá apoiar, portanto, na expansão do quadro do pessoal aqui do Conselho Nacional de Combate ao SIDA. E, neste momento, estamos num processo de finalização dos termos de referência dessa equipe de gestão do preservativo que vai ser contratada, portanto, aqui para o CNCS. Temos também em carteira várias ações, como a elaboração do plano de monitoragem e avaliação, dentre outras atividades consideradas também importantes. Muito obrigado.
Thank you, Isidio. That's a great presentation and wonderful to hear your experience in Mozambique. Look forward to hearing more how the plan goes as you roll it out. Thato Chidariki Jakiri, I apologize for mispronouncing the name, has a question. Do countries have tools for demand creation to increase condom use? I'll chime in to just quickly respond to this, is that one of the objectives of the South-to-South Learning Network is the identification of best practice and exporting that best practice to countries within the region. We are in early stages of that process where we are looking at what is working and innovative practices within specific countries and seeing what can be done to export them to neighboring countries. While there is not specific guidance in the Condom Planning Package per se, or the Condom Needs Estimation Tool in support of demand creation overall, we do know generally what works. I can also share a link to the condom a technical brief, which is available on the Global Fund website, which does outline some general best practice, but this is also an area that we will be investing in as we move forward. Susie mentioned and referenced the strategic initiative supporting 4 countries in the region, and demand creation will be one of those. As Brian also mentioned, this is a priority area that it is important to continue to invest in demand to ensure that we have sustained use and uptake of those condoms that are procured in the country programs themselves. If there are other questions, please, now is the time to do so. We have just a few minutes towards the end of this workshop to answer those questions, but I would like to throw a question out to both Brian and Hank as to how these tools can be accessed. I did include a link to the Condom Planning Package, and I will do so again for the Condom Needs Estimation Tool in the chat button. But is there support for countries to apply both of these tools in practice? Hank, and then Brian.
Thanks, Chris. Yes, there is support in the sense that through UNFPA or UNAIDS, a number of people and a number of people is getting more and more experienced. One has been trained or exposed, introduced to the tool, have used the tool, and are getting more and more experienced in using the tool. And I'm also available for demand-driven support. So if there is a demand from a country, I'm pretty reactive on specific issues, or to organize a training, or to help do the validation of the data, or to advise on specific aspects. In the past, pre-COVID, we tended to provide support through on-site, often 1 week long support from training, developing the tool, briefing of stakeholders, etc. So there is various modalities, but I'm hopeful that more and more countries, people at country level, are using it very effectively and quite independently. I recently saw a consultant who I didn't know, who had used it for Côte d'Ivoire, and only at the very end he came to me for some very specific questions, and it was a great exercise they had done. Yeah. But it requires, of course, if you want to use it fully independently, good familiarity with the tool, Excel, and being used to manipulating and interpreting data.
Thanks so much, Hank. Over to Brian. And Brian, there's also a question in the chat box in terms of from Pari. How long does the phase 1 to 3 of the condom planning package take generally?
Sure. Taking the first question about available resources, my answer is similar to Hank's, is that there's a growing number of people familiar with the tools and should be able to help you with the implementation of the tools. So a good starting point could be your UNFPA or UNAIDS office in country, who could then be in touch with regional and global staff as well. Chris and I are also available. And you should not hesitate. Please do reach out to us. I think our addresses, email addresses were included in the presentation, so you can also reach out to us. And one of our objectives over the coming months and years really is to build up a group of people who are based regionally, who can help national programs work through the tools and use them. The question about how long does phase 1 to 3 take? So that's sort of the prepare, assessing, and designing. So before implementation, we're recommending something like 3 to 6 months. I think many times people will say we don't have that much time. We want to do it faster, and it can be done faster. But we recommend taking that longer period, 3 to 6 months, so that you really have time to build the core stakeholder group who's going to be involved throughout the process, and whose commitment and input and buy-in is going to be critical to the implementation. So there's an investment up front to making sure that group is engaged. That might mean outside of the NAC and the Ministry of Health, it might mean other ministries, it might mean NGOs, it might mean the private sector. Getting them around the table to build the strategy collaboratively is critical. So that's why we're recommending it take a little bit longer time.
Thank you, Brian and Hank. We are just about approaching time. I'd like to hand it over to Carrie Mangold from the South to South Learning Network just to provide some closing comments. But before I do, thank you so much for your participation. We've had upwards of about 75 participants throughout this process. We have brought together those global champions of the condom programming, and we hope you take away from this that there are resources and people available to support your work in countries. But more importantly, we've also brought together representatives from dozens of countries throughout Africa that we will be relying on to export the best practice that's occurring in your country with neighboring countries. So thank you so much for your participation, and over to you, Carrie.
Thank you very much, Chris. So to all the panelists, the participants, colleagues and comrades on this webinar, as we conclude this webinar, I really just want to express my sincere appreciation to everyone for your participation. I think that your contributions have made this session really engaging and informative and incredibly valuable as we seek to reconnect with existing tools, existing approaches to guide effective and efficient national condom programs. As we've heard today, the condom program remains the stalwart pillar of HIV prevention, though we also recognize that there's an urgency to generate stronger demand and strengthen national programs and provide easier access to condoms. We know that there have been many advocacy efforts at a global level and through the GPC to create strategic initiatives for condoms and make resources available as well. And although we know this is really critical to address some of the challenges that are being faced by countries, we also got some really critical insight from the prevention self-assessment process that was facilitated by the South-South Learning Network, that countries want to reflect and rebuild their programs, going back to basics and leveraging the experience and the expertise and know-how that already exists in countries and already exists in the Global South. And so with this, the South-South Learning Network really commits to continuing our role in supporting the member countries to share these learnings and to support joint problem solving. We will continue to support countries to reflect on their condom programs and articulate plans of action and technical assistance needs. We will keep on supporting the implementation of your learning agendas. There will be additional webinars. We will support smaller link and learn sessions. For example, perhaps Tanzania might want to share with us their experiences, and Mozambique similarly. We'll support you in documenting and disseminating promising practices and support facilitating relationships and linkages across countries, but also with the very many esteemed colleagues that we had on the call today who were also offering support. So with these words, really, I just would like to thank you for your participation once more. As the South-South Learning Network, we look forward to following up with the country teams on this call today and taking these discussions forward. We also look forward to sharing the tools with you. We will share the country examples that have been mentioned today and also share links for other support that might be available to support the implementation of the two approaches and tools that were shared with you today. And so really on that note, I just want to thank you once again and close the webinar. So thank you everybody and goodbye.
Thanks, Carrie, and thanks, everybody. Have a good afternoon, evening.
Thank you. See you next time.
Bye. Thank you so much. I will be in touch. Bye.